normal bony landmarks seen on X-ray. Now, what is this? What do you think? Is this fracture? Oh my god, here is fracture too. All bones are fractured? No, these are not fractures. These are the growth plates that shows that this person is growing, means this is a child X-ray. So this is metaphysis, this is epiphysis, and this is the physis, or you can say this is the growth plate, cartilaginous growth plate, which is not fused. So this is not, this patient does not has stopped growing, it's still growing. So, and this is diaphysis, metaphysis, physis, and epiphysis. On X-ray, we also called a growth plate as a physis. Again, epiphysis, physis, metaphysis, and diaphysis. Diaphysis, metaphysis, epiphysis, physis, and metaphysis, physis, and epiphysis. You can see this is the epiphysis, this is growth plate or physis, this is metaphysis, and this is diaphysis. Similarly over here, diaphysis, metaphysis, physis, and epiphysis. What is apophysis? We already know about the diaphysis, metaphysis, and epiphysis, and recently we knew about the physis also. But what is apophysis? The apophysis is a normal developmental outgrowth of bone. Means that this is normal bone cortex, and this is sort of outgrowth or bulged of a bone, yeah, outgrowth of a bone, which is normal developmental outgrowth, right? Which arises from the separate ossification center. Separate ossification center and fuses to the bone later in development. An apophysis usually does not form a direct articulation with another bone at the joint, but often forms an important insertion point for a tendon or ligament. So what is important about the apophysis? The apophysis is a bony outgrowth which is normal developmental, arises from the separate center of ossification, does not form a direct articulation, and it is important insertion point for any ligament or tendon such as like Achilles tendon, or we can say the patellar ligament, and what we say the what in the greater trochanter there is a attachment of the gluteus maximus ligament tendon, or you can say there is a fascia lata, attachment of the fascia lata. So these are the important ligament and tendon which are attached on these apophyses. Like this is the tibial tuberosity, this is the calcaneal tuberosity or apophysis, okay, and this is also apophysis, right? And this is what? This is proximal femur epiphysis. Okay, this is the head of the femur, this is neck of the femur. So this is epiphysis, and this is growth plate, which is also called as a physis, right? Now this apophysis, this is the apophysis of the greater trochanter. So this apophysis give attachment to the gluteus maximus and fascia lata, and this apophysis give attachment to the Achilles tendon, right? And this tuberosity or apophysis give attachment to the patellar ligament. So these are the outgrowth of the bone which arises from the separate center of ossification, and they are important for the attachment they are important site for the attachment of ligaments or tendons, and even they can slough off in a like a major pull or something. So they can slough off also, these epiphysis. Now X-ray. You can see these are the vertebrae, these are the lumbar vertebrae, fourth lumbar vertebrae, fifth lumbar vertebrae, first sacral, second sacral, third sacral, fourth sacral, fifth sacral, and this is coccyx, right? And this is the ilium, right? This is the sacroiliac joint, this one, sacroiliac joint, and this is the ala of the sacrum. This is probably sacral promontory, which is not visible clearly, and this is the iliac crest. This is anterior superior iliac spine. This is anterior inferior iliac spine. This is the acetabulum. This is head of femur. This is neck of femur. This is trochanteric fossa, this one. This is greater trochanter. This is lesser trochanter, intertrochanteric line. This is ischium. This is pubis. This is superior pubic ramus. This is inferior pubic ramus. This is pubic tubercle. This is pectineal line. This is pubic crest. This one is the pubic crest. This is pectineal line. This is iliopectineal line, which forms the pelvic inlet or pelvic brim. This one. This is the iliopectineal line. This is the ilium, and this is the pectineal line of pubis. And this is pubic symphysis. This is pubic tubercle. This is pectineal surface, right? And this is the pubic crest. This is inferior pubic ramus. This is ramus of ischium. This is ischial tuberosity. This is body of ischium. This is body of ilium. This is ala of ilium. This is the iliac crest, right? This is the posterior superior iliac spine. This point, this is the ischial spine, right? And neck of femur, greater trochanter, lesser trochanter, head of femur, fovea. You can see this depression, fovea. Even over here, fovea, acetabulum, right? And what are these black like spots everywhere? This one you will see everywhere, not in this X-ray, but in other X-ray you will see there will be big spots of black. So this is actually air within intestine, because intestine are coiled around here, so they are also contain air. So these are the black shadows of this intestinal air, like this. These are black spots, right? So these black spots are actually air, nothing like abnormality within the bone. Now again, ala of ilium, iliac crest, right? Acetabulum, head of femur, neck of femur, greater trochanter, superior pubic ramus, inferior pubic ramus, body of pubis, pubic tubercle, pubic symphysis, pectineal line, pubic crest, pectineal surface, iliopectineal line, and sacroiliac joint, right? And greater sciatic notch, right? What else? Body of ischium. This is the ischial tuberosity, or the ischial tuberosity on which we sit. Actually, when we sit, We are sitting definitely on support of the pelvic bones. So which part of the bone which rests on the seat or floor or wherever we are sitting, that is the ischial tuberosity. So we sit on the ischial tuberosity, right? And this is the ramus of ischium, body of ischium, ischial tuberosity, and body of ilium, acetabulum, head of femur, neck of femur, greater trochanter, lesser trochanter, intertrochanteric line. Here you can see body of ischium, ischial tuberosity. This is the, what is this? Which foramen? Obturator foramen. Obturator foramen. Now, what is this? Oh my god. Yeah, this is screw. This is a non-displaced femoral neck fracture. So, non-displaced means the fracture has been occurred within the neck of the femur, but it is not displaced somewhere like on the right, left, or someone. So, if it's non-displaced, we can easily put internal fixation with the multiple cancellous screw. Here are the multiple screw, but in this is the single screw. I just wanted to show you, okay, this is the femoral neck fracture but in non-displaced. So they are supporting the femur to get fixed, remain fixed with the head of the femur to internal, with the internal fixation by multiple calcaneus screw. And this, the fracture must not be throughout the neck, it must be just up till half of the neck. So that is why single screw is being placed. This is the air which is present within the intestine, probably rectum. And what is this riser sign? What is this? Is that fracture? No, it shows that this person is growing. Again, apophysis. So the apophysis in the hip bone is also used to estimate the age of a patient. So this is called as a riser's sign. What? Riser sign. So what is riser sign? The riser signs an indirect measure of skeletal maturity. So this is the riser sign. If you see the riser sign, there are 5 stages of the riser signs. How much is filled, apophysis is filled or fixed, the age can be estimated, right? So whereby degree of ossification of iliac apophysis by X-ray evaluation is used to judge overall skeletal development. So roughly we can estimate the age by looking at this apophysis, how much the degree of apophysis is fixed or fused. So on the basis of that, we just take an X-ray and see the stages of the apophysis, and we can evaluate the age of the patient or overall skeletal development. Mineralization of the iliac apophysis. Mineralization will occur definitely. Apophysis begin at the anterolateral crest, like this is the anterolateral, this is posterolateral. So it start from the anterolateral, progress medially towards the spine, progress medially towards the spine. So start from here and progress medially towards the spine. Anterolaterally it start, and this is how, what is the importance of the riser sign? It is an indirect measure of the skeletal maturity, whereby degree of ossification of the iliac apophysis by an X-ray evaluation is used to judge overall skeletal development. There are 5 stages, so we will not go in detail of the riser sign stages. Mineralization of iliac apophysis begin at the anterolateral crest and progress medially towards the spine. So if you see this apophysis in hip bone, that means that this patient is growing or this person is growing. So growth occurs till 22 to 25 years of age, but depend on the degree of this will tell you the age of. Now these black spots, again I already told you, these are everywhere you can see, so there's nothing wrong with the bone, but it's actually air within the intestine. Again we can see I love the ilium, iliosacral joint, fourth lumbar vertebrae, fifth lumbar vertebrae, first sacral, second sacral, third sacral, fourth, fifth. This is coccyx, this one, this small, this is coccyx, this is pelvic brim or pelvic inlet formed by the ilium and pubis bone. This is the iliopectineal line, right? And again, these all structures we have already discussed, right? This is the trochanteric fossa, right? And this is, you can see a difference in these both. What is the difference? This is wider pelvis, this is comparatively narrow pelvis. Arch of this pelvis, this is the pubic arch, which is like a arch shape, and in this you can see this is V shape. It indicates narrow pelvis, heart shape, roughly heart shape pelvic inlet, narrow pelvis, and V shaped pubic arch suggestive of male pelvis. This is female pelvis because the arch is arch shaped, pelvic is wider, and the pelvic inlet is not heart shape, it is sort of anterior posteriorly side to side oval. And this is male pelvis, narrow, wider, V-shaped arch, arch-shaped arch, heart-shaped inlet, oval inlet sort of. So this is male pelvis, this is female pelvis. Again, you can see clearly this is the trochanteric fossa, greater trochanter, lesser trochanter, head of the femur, right? Acetabulum, head of the femur, neck of the femur, proximal end of the femur, shaft of the femur, superior pubic ramus, inferior pubic ramus, ramus of ischium, ischial tuberosity, body of ischium, body of ilium, iliopectineal line, pubic symphysis, right? Sacroiliac joint. That's it. Now, what is this shadow? Patella. This is patella. This is base of the patella. This is apex of the patella, right? And you can see the outline of the condyles. Clearly visible outlines of the medial and lateral condyle. This is the medial condyle because fibula is laterally, and this is the lateral condyle. You can see this is the growth plate is fused. So this person is not growing anymore. And what is this? Articular surface. And what is this? Intercondylar prominence. This is the intercondylar prominence. This is the intercondylar tubercle, medial intercondylar tubercle, lateral intercondylar tubercle, medial intercondylar tubercle in between two condyles. This is the medial intercondylar tubercle. This is the lateral intercondylar tubercle. Now what is this? This is the apex of the fibula, right? This is the posterior laterally. This is the superior surface of the fibula. And again in this you can see this is the apex, this is the head, and this is the neck of the fibula. And what is this? Articular surfaces. medial condyle, lateral condyle, medial condyle, lateral condyle, patella, and medial epicondyle. What is this? Medial epicondyle. And what is this prominence? What is this prominence? This prominence is the which tubercle? Adductor tubercle. This is the adductor tubercle, where the attachment of the adductor magnus muscle occurs. And which head of the adductor magnus, or which part? Hamstring part, right? I hope you remember that. We have recently done it. This is again riser's sign. It's more clear, right? And is this, you can see 1 is patella, 3 is epicondyle, 6 is medial condyle, 7 is the medial condyle of tibia, 6 is the medial condyle of femur. This is the medial intercondylar tubercle, and 4 is the articular surface, 5th is the apex of the fibula. That's it. This is the lateral view. 1 is the patella, 5 is the apex of patella, 4 is the articular surface, 2 is the fibula. You can see the superimposed shadow of the fibula. This is the Tabletuberosity. So Apophysis, Tabletuberosity. And what is this line? Patellar ligament. One end is attached to the apex of the patella. The second end is attached to the Tabletuberosity. Right? So these are the apophysis. They give attachment to the important ligaments and tendons. So again, this is the patellar ligament. This is the lateral view. This is anterior view. This is patella, and in this lateral view you can see patella, base, apex. This is the patellar ligament. What is this? Tabletuberosity. Medial intercondylar tubercle, lateral intercondylar tubercle. If suppose fibula will not be there, how will you identify which side is medial, which side is lateral? Right? So the medial intercondylar tubercle is sort of tall or larger as compared to the lateral one. You can even identify in that way. Foot. These are the tarsal bones, right? And these are the metatarsals, 5, and these are the phalanges, right? Also phalanges. So you can see again, this patient is also growing, right? Epiphysis and physis. So this also an X-ray of a growing person. This is the systemoid bone under the first metatarsal bone, right? And this is what? Calcaneum. This is fibula posteriorly, anteriorly is the tibia. This is the talus, like this. This is the talus. This is subtalar joint, right? And this is navicular. This is cuboid. This is medial cuneiform, middle cuneiform, lateral cuneiform, base of 5th metatarsal, or you can see TUB of the 5th metatarsal. TUB means I don't know what is TUB, but this is the base of 5th metatarsal. Tubercle of the 5th metatarsal bone, right? And these are the phalanges. In a grade 2 there are 2 phalanges, and the rest of the there are 3 phalanges, right? And what else? Again, navicular, cuboid, first cuneiform, middle cuneiform, lateral cuneiform is here. You can see first, second, third, fourth, and fifth metatarsal. This is the tubercle of the fifth metatarsal, which is visible over here. This is cuboid. The inferior surface of cuboid is over here. So these are the bones of foot. Now again, number one is the medial malleolus of tibia, lateral malleolus formed by fibula. This is the talar dome or trochlea. This is the talus, and this is the prominent part or bulged part of the talus, that is also called as the talar dome or trochlea. Right? Now you can see this is the calcaneal tuberosity. This is the calcaneal tuberosity number one. Right? So calcaneal tuberosity is again apophysis. Right? This is the calcaneum. This is subtalar joint. Right? This is the head of the talus. This is the neck of the talus. This is the trochlea of the talus. This is the talocrural joint or mortise joint, also called as the mortise joint, and navicular, medial cuneiform, but they are superimposed, medial, middle, and so we can just say this is the cuneiform, right? Medial, middle, or lateral, they are superimposed with each other. This is cuboid. This is base of fifth metatarsal bone. What is this? Seventh. Seventh is what? Tuberosity of the base of fifth metatarsal bone. And 6 is what? Cuboid, right? And this is the medial cuneiform, 10th, but they are behind the shadow of the middle and lateral cuneiform also. Now the systemoid bones. The systemoid bone, you can see this is the first, second, third, fourth, and fifth metatarsal bone of foot. These are the this is the proximal end of the metatarsal bone. This is the distal end, right? These are the phalanges. So metatarsophalangeal joint. So at the proximal end, normally there are two bones are present from the inferior surface. These are the sesamoid bones, right? This is the largest sesamoid bone, that is the patella. This is the fibula. Fibula is again a sesamoid bone present within the tendon of the gastrocnemius muscle of the posterior compartment. The posterior bulge of the leg is due to the gastrocnemius muscle, and this is the tendon of the gastrocnemius muscle which passes from here, and this is the bone present within the tendon of the gastrocnemius muscle, but this is not always present. Like patella is always present, this is majority of time is present, but this sometimes rarely seen, right? So these are the sesamoid bones. Now what are the types of fractures? There are hairline fractures. Suppose this one is just a breach within the cortex, right? This is an incomplete fracture. So hairline is incomplete fracture, usually resulting from minor injury that does not go all the way through the bone. So even it does not involve all the cortex. So it's just a breach within the cortex, and this is an incomplete fracture, and more commonly it is called as a hairline fracture, or we also say कि बाल आ गया, हड्डी में बाल आ गया है, तो that is the hairline fracture, right? बाल आ गया जिसको बोलते हैं. And then we have a transverse fracture. This is the transverse fracture, a simple fracture that is complete. You can see this is a complete fracture. This is incomplete fracture. It occurs due to torsion of the bone, right? So this is a complete fracture, and this is also, there are types of complete fracture. So this is the transverse fracture of a variety of complete fracture. So this is the transverse fracture. Now this is the oblique fracture. You can see this was the transverse. This is sort of oblique fracture, right? Oblique fracture, slightly oblique of the fracture. The slight obliquity of the fracture occurs due to the compression force. Now you can see this is the green stick fracture. This is the green stick fracture is an incomplete fracture. This is not a complete fracture. The green stick fracture is not a complete fracture in which the bone is bent. This is bone is bent, slightly bent. This fracture type most common occur in children, mainly distal end of the tibia or fibula. So this type of green stick fractures occurs which is incomplete and in which the bone is bent, slightly bent. This is oblique fracture, this is transverse fracture. These both are examples of a complete fracture, and these both are incomplete fracture, which is hairline and green stick fracture. This fracture most commonly we say baal aa gaya. Now we have spiral fracture occurs due to the torsion force. This is the spiral fracture, right? It's a sort of irregularly in oblique way, but not the regular cut of the in oblique way. Comminuted fracture occur due to the high energy force, like in a car accident, vehicle accident, in which the bone is fragmented, right? Part of bone is fragmented. So high energy force is normally present within the accidents में हम देखते हैं कि it's an vehicle accident में this type of fracture occur, that is called as a comminuted fracture, in which the part of bone get fragmented. Now we have displaced fracture, or you can say the fragmented or segment of bone comes out of the place, right? So this is displaced. Even if the bone segment, a fragment does not come out, but the bones, one bone go this side, one bone go this side, this is also will be displaced fracture, right? So this is displaced and fragmented. A fracture can be either open or closed. Okay. So open fracture, the fractures that penetrate the skin are open like this. The fractures that do not penetrate the skin are closed. So what we have learned, the fractures are of two types, open or closed, and fracture are of again two types. It can be complete or incomplete. Then we have a variety: incomplete, the transverse, oblique, spiral, fragmented, comminuted fractures. So these all are the examples of the open fractures, where the closed fractures, not open, complete fractures, whereas the incomplete fractures was number one hairline and number two was green stick fracture. So green stick fracture is more common in children, in which the bone slightly bent and not completely break. Now you can see this is an incomplete fracture, this is an incomplete fracture, right? So this look like a transverse, or it's incomplete, we cannot say transverse, but this is incomplete fracture, right? And here you can say fragmented. So this medial malleolus is pulled down. Maybe there is a ligament attached. So this is the eversion injury, in which you can see here is also a breach within the lateral malleolus, this one. Can you see this? There is a break in continuation, and you can see this obliquely coming. So this might be inversion, means when your foot is turned towards the medial side. Eversion means when your foot is turned outside. So this is the eversion injury most probably, and ligament which is attached on the medial malleolus has more like stretch on the medial malleolus. So this part is sloughed off, where the pressure has been also occurred on the lateral ligament. So that is why this part is fractured but not fragmented or came out or sloughed out. You can see this is the cavity, this is the cortex, right? Again, cavity, medulla, cortex of the bone. Which bone is this? Which bone is this? What is this? You have to tell yourself. Yes, this is not a hairline fracture, right? The bone is slightly bent. This is green stick fracture, right? And this is spiral fracture, right? And this is uh, comminuted fracture, displaced fracture and spiral. So I think you will be bit familiar to X-rays now. This patient is not growing, huh? Look, they are fused. Growth plates are fused. What is identification? What is wrong in this X-ray? Can you notice anything wrong in this X-ray or any fracture in this X-ray? Yes, I can see. You can see this is the patella, and you can see this patella is fractured. Can you notice? This is patella, right? And this is open patella. This is fractured patella. And can you notice these lines? This shows okay, this must be applying cast. What is cast? This is cast, which is being applied when fractures occur. So this is not the same patient, because this cast is applied on leg, but this cast is at the thigh. So this probably a cast, and this is the patellar fracture. What is this? Displaced patella. Look, it should be over here. This is not the lateral view, right? But it is on the side. So this is displaced patella. Quiz. What is 10? What is 11? What is 5, 4, 6, 3, 7, 2, 8, 9, 1? So you have to answer yourself. Again quiz. What is 5, 3, 4, 2 and 1? This is important, you have to tell. 2 again important. 3, 4, 5, 6, 7, 8, 9, 10. So we have learned everything. So I'm sure you must be able to answer these. Again, what is this? What is this? What is this? So easy. 1, 2, 3, 4. So easy. Questions, concerns, and comments.